Have you heard about berberine and its potential benefits for managing diabetes? It's a compound found in several plants, including goldenseal, barberry, and Oregon grape, and has gained popularity for its supposed ability to help control blood sugar levels. While berberine may offer some promising benefits, it's essential to be aware of the potential dangerous side effects it can have, especially if you have diabetes. Let's dive into what berberine is, how it works, and the risks you should consider before incorporating it into your health regimen. Berberine has been used in traditional Chinese and Ayurvedic medicine for centuries, primarily for its antimicrobial and anti-inflammatory properties. Recently, it has attracted attention for its potential in managing diabetes. Research has shown that berberine can activate an enzyme called AMP-activated protein kinase, or AMPK, which plays a role in regulating metabolism. By activating AMPK, berberine can help improve insulin sensitivity and reduce blood sugar levels. A study published in the journal Metabolism in 2008 found that berberine was effective in lowering blood sugar levels in patients with type 2 diabetes. In this study, 116 patients with type 2 diabetes were given either berberine or a placebo for 3 months. The results showed that the berberine group had significant reductions in fasting blood glucose and HbA1c levels compared to the placebo group. Another study published in Phytomedicine in 2010 found that berberine improved insulin sensitivity and reduced insulin resistance in people with metabolic syndrome. While these findings are promising, they come with a caveat. Berberine can interact with various medications and cause significant side effects. One of the primary concerns is its potential to cause hypoglycemia, especially when taken with other blood sugar-lowering medications. Hypoglycemia, or low blood sugar, can be a dangerous condition that leads to symptoms such as dizziness, confusion, and, in severe cases, loss of consciousness or seizures. Therefore, if you are already taking medications for diabetes, adding berberine to the mix could increase the risk of hypoglycemia. Another potential side effect of berberine is gastrointestinal discomfort. Many users report experiencing stomach cramps, diarrhea, constipation, and nausea. A 2015 review published in the Journal of Ethnopharmacology noted that these gastrointestinal issues are among the most commonly reported side effects of berberine. This can be particularly troubling for individuals with diabetes who may already experience gastrointestinal problems due to their condition or medications. Berberine can also affect the absorption and metabolism of other medications. For instance, it is known to inhibit certain liver enzymes involved in drug metabolism, such as CYP3A4. This inhibition can lead to increased blood levels of medications that are metabolized by these enzymes, potentially causing toxicity. For example, if you are taking statins to manage cholesterol, combining them with berberine could increase the risk of muscle pain, liver damage, or other statin-related side effects. A study published in Clinical Pharmacokinetics in 2012 highlighted these interactions, warning that berberine could increase the plasma concentration of drugs metabolized by CYP3A4. This is particularly concerning for patients on multiple medications, as it complicates the management of their conditions and increases the risk of adverse effects. Furthermore, berberine has been shown to have anticoagulant properties, which means it can thin the blood. While this might be beneficial in preventing blood clots, it poses a risk for those who are already taking blood thinners like warfarin or aspirin. Combining berberine with these medications can increase the risk of bleeding and bruising. A study in thrombosis research in 2013 emphasized the need for caution when using berberine alongside anticoagulant therapy. Berberine can also affect the heart by potentially causing a drop in blood pressure. While this might seem beneficial for those with hypertension, it can be dangerous for individuals with low blood pressure or those taking medications to lower their blood pressure. A sudden drop in blood pressure can lead to dizziness, fainting, and, in severe cases, shock. Another study in the Journal of Cardiovascular Pharmacology in 2014 found that while berberine could have beneficial effects on blood pressure, it must be used with caution, especially in patients with cardiovascular conditions or those on antihypertensive medications. Moreover, long-term use of berberine has not been extensively studied, and there is limited information on its safety profile over extended periods. This lack of data means that the potential long-term side effects are unknown, making it crucial to approach its use with caution, especially for chronic conditions like diabetes. Pregnant and breastfeeding women should avoid berberine due to potential risks to the fetus or infant. Animal studies have shown that berberine can cross the placenta and enter breast milk, which could pose risks to the developing baby. Therefore, if you are pregnant or nursing, it is best to avoid berberine unless advised otherwise by a healthcare professional. Despite these risks, some people with diabetes might still consider taking berberine due to its potential benefits. If you are thinking about trying berberine, it is vital to consult with your healthcare provider first. They can help you weigh the potential benefits against the risks and determine if berberine is appropriate for your situation. They can also monitor your health and adjust your medications as needed to prevent adverse interactions and side effects. In summary, while berberine shows promise for managing blood sugar levels and improving insulin sensitivity, it is not without risks. The potential for hypoglycemia, gastrointestinal discomfort, drug interactions, and other side effects means that berberine should be used with caution, particularly for individuals with diabetes who are already on medication. Consulting with your healthcare provider is essential before adding berberine to your regimen. Now, for the critical part, the best for last. There's an intriguing aspect of berberine that isn't widely discussed but could significantly impact its use. Berberine's ability to alter gut microbiota has caught the attention of researchers. A 2015 study published in Scientific Reports found that berberine could modify the gut microbiome composition in a way that might contribute to its glucose-lowering effects. However, altering gut bacteria can have unpredictable and potentially harmful consequences, particularly if the balance of beneficial and harmful bacteria is disrupted. This disruption could lead to gastrointestinal issues, immune system imbalances, and even exacerbate metabolic conditions. Therefore, while the modulation of gut microbiota could partly explain berberine's benefits, it also adds another layer of complexity and risk, emphasizing the need for careful consideration and professional guidance when using berberine for diabetes management. In conclusion, berberine offers a promising natural option for managing diabetes, but it comes with a range of potential side effects and risks that must not be overlooked. From the risk of hypoglycemia and gastrointestinal discomfort to complex drug interactions and potential impacts on gut health, the use of berberine should be approached with caution. Always consult with your healthcare provider to ensure that any new supplement or medication is safe and appropriate for your specific health needs.